so we inspect. So we're looking for various abnormalities of the limbs or the head. Then we are going to palpate, and we're looking for various things. Let's have a look. We'll just get the order of examination down first. Range of motion. Range of motion. Now, we just learned active and passive. And then muscle strength testing. That is how we examine this as a system for the exam. Looks deceptively easy, doesn't it? Your problem is, right, joints have got lots of ranges of motion, and you've got to know the difference between active range of motion and passive range of motion. So active range of motion is when they do it themselves. Passive range of motion is when you do it for them. Okay? Because those two things make a difference. When you do something actively yourself, all of the muscles have to contract in order to get that movement to happen. When you do it passively, the muscles aren't supposed to be working, so you'll get different response each time. So you've got to know how to do active and passive range of motion on all of these joints. And then you've got to know how to do muscle strength testing. Now when we're learning this, right, as like a discrete unit, we'll teach, well, first of all, you've got to know the anatomy, like the origins, insertions, the attachments of all the muscles. And then you've got to know what happens when they contract, right? And so that's a good couple of weeks. And then you learn the active and passive ranges of motion. That's another couple of weeks. And then on top of that, you've got this, the hardest bit is learning to do muscle strength testing. So you can't really do that effectively until you really know how to do range of motion. And so because you've got to be able to, you have to know the range of motion before you can do muscle strength testing. So you have got to learn all of that this morning, okay?
Really? Really?
You're all right, because you guys know this stuff.
Well, we forgot already.
Are we explaining the band A, band H
What's that?
of the muscle?
No.
Okay.
No.
Okay.
So there's a lot, and in the exam you have to do 2 joints. All right. So you've got to do the active and passive range of motion for 2 joints.
2 joints to choose from, or out of 600 joints we pick 2 joints based on luck.
No, I'm going to tell you. It's on the case. Yeah, the case study.
I don't know whether they're gonna give us like, pinky joints,
Let's say we
strength
can
testing.
only remember how to do TMJ. But the case study to do with an ankle, can we still pick TMJ?
No.
Okay.
But here's what I do. No, Dad. It's not that simple.
I bribed you for no
When the
reason.
patient comes in with TMJ and you check their ankle,
Yeah.
oh, you got TMJ problem, probably I'll check your toe.
That's our acupuncturist.
Oh yeah, TMJ like 5 and 3.
Should be 2.
This 2 is the most powerful lockjaw. Hopefully they give us the normal joint,
What do you mean?
like normal joint, arm and legs and knees, neck.
Yeah. So, tick, we need to do shoulder. Knee.
That's basically almost everything already. TMJ.
Yeah, it is on.
Right. Alright, so when we've got, so knee is pretty easy because it only does one thing, right? Neck has only got 3 ranges of motion. So knee has got 1, TMJ has got 3, neck has got 3, lumbar spine has really got none. It's the hip that's got lots. And this one's got lots.
Because they do circumduction.
Yeah. So anyway, let's just get started here. So inspection. What are we looking for?
The gates when they walk.
Hang on. When we're inspecting joints, we have to make commentary about contour symmetry, muscle size, any visible swellings, discolorations, if the alignment of the spine, so in the case of a lumbar spine or a neck, if there's a scoliosis. Visible deformities, visible swellings, essentially the same thing. Muscle size, that's really obvious. So when you see symmetry, you know muscle sizes are the same. So there can be no swelling. It's just remembering those prompts in your brain. Okay? So that's all you're doing. So you're looking at both of the joints. So if it's shoulder and neck, you're looking for alignment of the spine, and the shoulders are even. Okay, so they're the same. There's no swelling, and there's no loss of muscle tone. Yeah? No lesions, scars, bruising. And that's about it. So that would be the same for the 2 joints that you get. Then we palpate. So we start at the top of the shoulders and work down, feeling for heat, temperature, muscle atrophy, pain, temperature, lymph nodes if it's on the neck, any bony deformities, tendons, muscles, tissues, landmarks. So the landmarks are, so if we make up a table for landmarks, we've got shoulder is the AC joint, and that's this bony thing on here. Knee is patella, the kneecap, bony landmark. Hip is greater trochanter. TMJ, what's the bony landmark for there?
The mandibular.
Mandibular head.
Mandibular head and
I reckon yes, but I'd say zygomatic. So
zygomatic is a little bit on top here. Yeah. This is mandibular, this is zygomatic.
Arch? Zygomatic arch or the actual?
I think
So
we'll
the
go
arch is here.
I think you just recite mandibular head.
Okay. TMJ. Because TM, mandibular, easier.
Mandibular head.
Mandibular head.
Neck,
Neck.
spinous processes,
Cervical spine. Spinous. Nose. Cross.
lumbar spine, spinous processes. Alright, so the spinous processes are these. steady. So these are the spinous processes here, right? So there's the bony landmarks, and these ones down here. Those ones that look like the back of the Brachiosaurus. Alright? So pain and tenderness, when we're palpating, we're feeling the temperature, pain and tenderness, associated bony landmarks, relevant tissue, so you just say the muscles, just talk about the muscles, alright? And then bony deformities, no bony deformities. And now we do range of motion. So it says that all relevant range of motion performed actively for each joint. All range of motions performed bilaterally for each joint involved as per the case scenario. And then, so we've got to do all of these. So I'm going to demonstrate them. No, any difficulties in range of motion or restricted range of motions? Passive range of motion performed for any restricted active ranges of motion. So what that means is in the case study, right, you could have a sore knee. And so they want you to do passive range of motion just on the sore knee. Which is, for me, it's like, that's too confusing. Just learn active and passive range of motion and do it all. So you don't have to think another step up, because it's only a hypothetical situation, it's not a real life case. And when you get out there in real clinic land, you'll be able to figure out if you want to do both active and passive range of motion, right? So we do active and passive, and then we do muscle strength testing. So I've got this chart here. So muscle strength testing. This is the one that all of us are going to have today. Active movements against full resistance without evident fatigue and against gravity. So when you muscle strength test, you've got to push into, so this is my hand that's applying the force, and this is the one that's being tested. It's got to be pushed against resistance and gravity, right? So you're all going to be a 5+. So everything you're going to come up with today is going to be a 5+. Here is the list, so how we grade it. We grade it from 0 to 5. 0 is where nothing is going to happen. So if you can imagine you've had a stroke, or someone's had a stroke on this side, so this side of the body has been affected, and this arm just dangles like that. It's actually going to be held in a sling to keep it from flopping all over the place, right? So that one has got a 0. That's a 0, where it can just do nothing. 0, no detection of muscular contraction. Number 1 is a barely detectable flicker or a trace of contraction with observation or palpation. So these are all things that you'll be able to do if you've got hands-on experience with someone or with people. And it varies, and sometimes it's not clear cut. It's just and sometimes it won't necessarily vary from day to day, but you can test against gravity or not against resistance, but there's too much detail here for today. So for today, just know that when you go testing or your partner, it's going to be a 5+. Muscle strength checked correctly against gravity. Observation stated accurately and described thoroughly using the correct grading scale that describes full or active restricted range of motion against full or some or no resistance against gravity or with gravity. So when you say it's a 5+, then that automatically ticks off all of those. All right?
So we just need to say 5+ to tick off the 3 boxes.
Muscle strength checked correctly against full resistance during range of movements at the joint. So this is the thing that you have to do. Resistance offered in mid-action, clear instructions given. So that's the skill, and then you just report it and say that it's 5 kids, full strength against gravity. Okay. So now what we've got to do is we've got to learn the ranges of motion. So that's usually me standing up here doing some sort of yoga, and you guys taking a video. So we do, depends on how we want to do it. We do active range of motion, then I've got to show passive, and then I've got to show muscle strength testing. Shall we just do all of that per joint, or do you want to do all the ranges of motion? Do all of the ranges of motion passive, and then all of the muscle strength testing.
And then per joint.
Per joint. All right. So TMJ, so this is the one that I do all the time. So it's only, so how does it go? What sort of things, so in the exam you get TMJ? Yeah, so start wiggling your joint. So while you're there, what can you do?
Move it from left to right. Forwards, Thanks, Sharon.
You be careful with that, right?
That's easy.
Protraction. Retracting.
Elevation.
Elevation is like this. And this is depression.
Side to side. The weird one.
Side to side. We actually call that lateral excursion
Natural.
or lateral deviation in my land. But in your land, it's side to side.
So easy.
Distraction is what? Open the mouth.
No, depression. Depression.
So,
Open.
That's easy actively. How are you going to do that on a patient?
How you gonna tell?
Can you open your
No, you
mouth?
can't. You've got to do it. So protraction is.
Oh, okay.
Alright.
And
That's
then,
the passive way. Oh, group.
Do you communicate it verbally as well, or do you
Yes.
just?
So you say. So in the clinic, if it's protraction, I'll probably get this, and then I'll push it back. We haven't done muscle strength testing, right? Depression's easy. Elevation, I guess. Just don't put your fingers in there. And then muscle strength testing is push that way against my hand,
Test that.
Itu boleh nak gampang ya.
and then
tahu
push
ini,
backwards
nggak pernah.
into my fingers.
That's good.
Push over to this side. Push over to this side. And then this is the tricky one. This is easy.
And then
We hold the pointy with that.
Use the glove.
Honestly, I don't test muscle strength testing on that one
exactly. Why would people test it?
because it's an exam.
Oh my god.
Right. So, cervical spine is flexion, extension, lateral bending, rotation. We're not doing circumduction.
No do.
What is circumduction?
I think that one hurts the joint more.
It does work the joint, but
Yeah.
not for this exam. All right, so that's active range of motion. Passive range of motion is
You do it yourself. And then
Ini gampang.
yeah,
Gampang lah.
And
Yang ini
then,
gampang. Tadi saya nggak tahu.
muscle strength testing. Push into my hand. Push back. Push to
And
the
eating.
side.
Ujian Vivian ada.
yeah.
Push to the side, and try and push into my hand. That, I must admit, I do with my patients a fair bit. Right, lumbar spine. Now, lumbar spine, look at this. Do you think this lumbar spine is meant for range of motion?
Yes.
Extension. Rotation. Cuma 3 kok.
It's a very
Blood
big,
flow flexion.
stable thing. There's really no points for movement through there, is there?
Nice.
This one here, yes, right? This one here, it's got rotation, it's got flexion, extension. This one can do a little bit of forward flexion, right? Flexion, maybe forwards, but it's only very limited. It would be limited to here, right? Anything going over there starts to be hip flexion, right?
Yeah.
You see what I mean?
Or your
So
thrust.
that's the flexion you've got. Extension is there. Side bending is like this, like this. This is actually a really good test for facet joint inflammation. So this here is a little facet joint, right? And if you can imagine, if you tilt this way, you're compressing those two together, right? And so if you've got facet joint inflammation, it goes bing, and you go oof. So that's how you know if you've got facet joint inflammation, right? So that's side bending. So that's about all you've got there. And then you've got rotation. Now these joints don't look like they really rotate much to me.
This one is old, I think.
He's definitely old. But this is what they're wanting, this is what they're calling lumbar rotation. But it's really not lumbar rotation, is it?
Thoracic more.
It is, but it's
More
more just,
thoracic.
it's more just the muscles doing that movement.
Actually, lumbar doesn't really move, right?
No, lumbar doesn't really move.
Because they are so
That's right,
fused
they're
together.
meant to be solid.
Yeah.
So all you've really got is a little bit of flexion, like that. Back. Side, side, and then some pretend rotation. And that's it. Hmm?
I thought it was always the lower back that was bent. It's
Mm.
my brain's not smart.
No, you just weren't showing. So people who know this really well are dancers, right? Because we're always standing there here, and if we try and bend like this, it's not going to work. Always,
At the hips.
yes, right? So everything from when you're doing ballet, contemporary dance is always we bend from the hips because that's really the only fulcrum you have for flexion, isn't it? When you think about it. So range of motion for the lumbar spine. That is that. So how are you going to do passive?
Push it.
That's it. So you're going to get the person and you're going to tilt them over. But it's pretty hard. Have you ever done passive range? Therapists in the class, who has done passive range of motion? Yeah? How
Like
did you
under
do it?
testing condition, like really crazy testing condition.
Really crazy testing.
Yeah, so I think I would be standing for those ones, not like you could do it sideline if you had a large amount of people, I think, for some of them. But yeah, will we be tested standing for those ones?
Look, you guys who know what you're doing, if you feel like you've got time, you do what you're going to do, right? Because I'm giving the very brief version, right? But generally, if it's passive range, do what Sue just said. Just take them over, make them over.
And the person pretend to just rub with
Do you
you.
just
Yeah.
hug them from behind or from
Yeah.
Just hold them and rock. And you pretend to move with me. Pretend to move.
That's it. That's it.
Before.
Yeah.
Alright? And then muscle strength testing. That's actually a bit easy. You put your hand here and get them to try and move them forward. Press here, get them to try and move back. Put your hand here and stop them rotating. Put your hand here, stop them rotating. And put your hand here to stop them from bending over, bending over. So that muscle strength testing is actually easier on lumbar spine than range of motion. Now what's next? Shoulder and hip. So shoulder's got lots of range of motion.
Abduction.
So-
Abduction.
Flexion,
Extension.
extension. Abduction. As soon as you go past here, it becomes adduction back to the midline.
Abduction.
Abduction,
ABD.
all of that
ABD.
abduction.
ABD.
Adduction back to the
Reduction by
midline.
midline.
External rotation, internal rotation. Circumduction. Elevation, depression.
Depression and
Elevation.
Depression.
Like shrugging.
And that should be it.
What is the difference between ab and ad again?
Abduction taking away from the midline, adduction coming
Right.
back into the midline. Adding to the body.
Yeah.
kalau ini apa? Kalau begini.
ADD.
Ya,
So,
ADD apa?
passive
Adduction.
range of motion on this is pretty
Bukan extra
good.
adduction.
Adduction.
Ini adduction udah di sini udah.
No, to the midline. Adduction.
Flexion, extension, abduction, adduction.
Horizontal adduction. Apa sih? Ada yang bilang horizontal. Ingat Pak?
Enggak gitu banyak.
Nggak penting.
Ini extension, ini
Flexion.
flexion.
Flexion. Extension.
When we're
Extension ini
going
kan?
through this,
Extension.
we have to
Flexion.
Flexion.
Circumduction.
Adduction.
Abduction.
And then
Yes.
ABD.
But-
ABD.
Okay, so,
ADD.
good question. Do you have to know all the terms? Yes. If you don't, is it disaster? No. So, and it's really important, a great question, because I can allocate marks if you go through the ranges, but without naming them. All right?
Do we got minus mark if we're not naming them?
No.
Like less mark.
Yeah.
But got mark.
Yeah. So we've done flexion, extension, abduction, adduction. So external rotation, internal rotation, elevation, depression.
Circumduction.
Oh, circumduction. Using Skelly's been good. All right, so how we're going to do, so we've done passive range, we've done active, now we're going to do muscle strength testing. So we're going to pretend he's got all these muscles, and I'm going to press here, and he's going to try and push forward like that. Then he's going to try and push backwards, then he's going to try and push outwards, and I'm going to resist, then he's going to try and push inwards. So 1, 2, 3, 4. I'm going to stop him pushing his hand in, and I'm going to stop him pushing his hand out. Now you can do both arms at the same time, right? So you'll be standing there like this, and you stop them pushing their hands out, stop them pushing their hands in. With the arms like this, stop them pushing into you, and then put your hands behind, stopping them pushing back, stop them pushing out, stop them pushing in. So very basic range of motion for shoulder, and then resisting elevation. So resisting them going up like that. And then depression, it would have to be resisting them pressing down like that on the elbow. So I think it's many breeze here. So we've done TMJ, shoulder. Now we've done lumbar spine, we've done neck, so we're doing good. Now we've done just knee, and what else?
Hip.
Hip. Knee is pretty good. Active range of motion is flexion and extension. Bit of hyperextension. So that's pretty easy.
Extension and
Active
Flexion.
range, flexion,
Flexion.
extension. Passive, yep, flexion, extension, and muscle strength testing is pressing into here and then pressing back like that.
Oh, like the knee.
When they're sitting or standing.
Supination.
Better
extension kan kaki ke depan kan. Terus kalau
Supination.
extension ke belakang kan flexion.
Extension
Begini
ke
kan?
depan.
Oh, that was
Ini kan
probably
extension like that.
Yeah, go away.
Kalau ini cuma ditekuk aja gini kan.
Extension, hyperextension,
I just use
elbows, knees, and then below that supination, Yeah, just below.
It's
Right.
just the elbow, it says.
Oh, here.
Oh, is that elbow only?
Yeah.
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 Oh, of course.
But we're not, it's not on the list.
Oh, so elbow and knees is not.
The knee is on the list, but
It
ankle's
says
not.
elbows only. for the
Ankle's
sit
not,
position.
no, neither, no. Is that anyone you know?
Yang mana, yang mana, yang mana, yang mana?
Their knee and ankle would be if it wants to go for
Wrist and hand or ankle and foot. Kita
So,
tak ada wrist and hand, ankle and foot tak ada.
Maksudnya apa
So
sih?
now we've got hip. Oh, did we did hip.
No.
No, I don't hip. I put it actually. So hip range of motion is flexion. I'll do them actively. Flexion, extension, abduction, adduction, external rotation, internal rotation, circumduction. But we don't have, that's not on the actually. Internal, external, flexion, extension, internal, external, that's enough.
Elevation and
Can you do
depression.
internal and external again? I didn't see it.
I'll do it on Skelly. So it's external rotation, internal rotation. External, internal. So passive range of motion, flexion. Come on, Skelly, you can do it. No, you can't. Flexion. Extension. Extension. Abduction. Adduction. Internal rotation. External rotation. So external rotation is when you put your feet into turnout. Internal rotation is the other way.
One question. How to do the passive for them? They have to be
Laying down.
like no laying down. How to do the extension? Oh yeah, you can do this because the flexion you can go up and then extension super laying pronation.
I'm going to show you how to do it actually because you need to see that because you have to be laying down. And then
Oh, on the side boleh ya.
and then
Saya lupa
I think I
semua
will
ini.
show you that. I'm going to need a bed because you can't be standing up. So everyone that's come.